Let's get right into it. Today, in this explainer, we are tackling something that literally affects millions of people every single year. But, it's kind of one of those topics people just don't want to talk about. We're breaking down urinary tract infections, or UTIs. Whether you're dealing with one right now, or you just want to make absolutely sure you prevent the next one, we're going to look at exactly what is going on inside your body. So tell me if this sounds familiar. Have you ever felt that awful, intense burning sensation when you try to pee? Or maybe that super frustrating, maddening urge to sprint to the bathroom only for basically nothing to happen? Yeah, those are the classic, exhausting warning signs of a UTI. And if you're nodding along right now, trust me, you are definitely not alone. Okay, let's dive into this. Here is our roadmap for today. We'll start with number 1, what is a UTI? Then 2, spotting the warning signs. 3, uncovering the root causes. 4, your daily defense plan. And finally, 5, when to see a doctor.
All right, section 1. What is a UTI?
At its core, a UTI is literally just a bacterial invasion. It happens when unwanted bacteria somehow bypass your body's natural defenses and crash the party in your urinary system. This can affect your bladder, urethra, kidneys, or ureters. To put this into perspective, your urinary tract is designed to be a completely sterile environment, like zero bacteria. So even a microscopic amount of bacteria sneaking in can trigger this massive, super uncomfortable immune response.
Now, anatomy plays a huge role here. Women are just inherently more susceptible to these infections. Why? It's pretty simple, actually. A shorter urethra just means a much shorter physical distance for those invading bacteria to travel to reach the bladder. It's like a fast pass for bugs. But hey, here's the really reassuring medical outlook. Despite that geographical disadvantage, a UTI is highly, highly treatable if you catch it early.
Moving on to section 2, spotting the warning signs. Your body has a fantastic built-in alarm system, and you really need to listen to it. The early signs, they are highly uncomfortable. We're talking that trademark burning when you pee, the frequent urge to go, cloudy or foul-smelling urine, and even pelvic pain. But you really got to watch out for the severe escalation signs. If you suddenly get a fever or severe back pain, that's a huge red flag. It strongly indicates the bacteria have actually traveled all the way up to your kidneys, turning a localized annoyance into a very serious systemic issue. Section 3 now, uncovering the root causes. So what's actually causing this? E. coli is the most common bacterial culprit here. But how does it actually take hold? Honestly, a lot of times, it just comes down to our daily habits. Think about being stuck in a long meeting and just holding it in. That stagnant urine basically acts like a petri dish, allowing bacteria to multiply incredibly fast, sometimes literally doubling in number every 20 minutes. No way, right? Other common entry points include not drinking enough water, poor hygiene, sexual activity, or having underlying conditions like diabetes or a weakened immune system that just lower your body's natural defenses.
All right, section 4, your daily defense plan.
I love this part because this is your personal shield. It puts you in total control of your urinary hygiene. Step 1, and this is absolutely crucial, drink plenty of water. It constantly flushes the system out. Step 2, never, ever hold your urine when you feel the urge. Just go. Step 3, always wipe from front to back to keep bacteria as far away from the urethra as possible. Step 4, make it a strict habit to urinate after sexual activity. And step 5, wear breathable cotton underwear. It prevents the trapping of moisture, which is exactly the kind of environment bacteria absolutely love to breed in. And finally, section 5, when to see a doctor. So the crucial point on this slide is the number 2. 2 days. When it comes to UTIs, 48 hours is your golden rule. If you're dealing with those irritating, painful symptoms and they last for more than 2 days, it is time to stop trying to wait it out. You need to call in an ally and escalate the situation. Let's be super clear and leave zero ambiguity here. You need to see a healthcare professional immediately if you cross that 2-day mark. But also, regardless of how long you've had symptoms, if you suddenly develop a fever, get severe back pain, or notice any blood in your urine, do not wait. Go immediately. Those are major escalation points that mean you need a doctor right away to protect your kidneys. Now, take a deep breath, because the good news is that if you do need a doctor, the solution is really straightforward. UTIs respond exceptionally well to prescribed antibiotics. It basically acts as the ultimate rescue, quickly neutralizing the bacteria. The only real danger here? Stubbornness. Delaying this incredibly simple, effective treatment is exactly what allows that bacteria to travel upward and cause those really severe, painful kidney infections we just talked about.
As we wrap up this explainer, I want to leave you with a quick thought. Will you listen to your body's early warning signs before a minor infection becomes a major complication? Remember, hydration and good habits are your daily shield, but early action, that is your ultimate cure. Never ignore what your body is trying to tell you. Thanks for joining me today, and take care of yourselves.